All right, go ahead and get started. Thank you all for being here today. We got a packed house. We'll have James English and Kevin Dick from the Washington County Health District and the Regional COVID-19 Response Team, as well as Adam Parath from Renown Health and Dr. Travis Anderson from Northern Nevada Medical Center will be available for questions. Just a quick update on the COVID-19 dashboard. We're still having our GIS team work on it and updating some of the data feeds. Apologize it's not available, but we're working on it to get it back up as soon as possible. We're still updating the case counts, deaths, and recoveries, and you can find those as always on COVID19washoe.com and our Twitter, COVID19washoe. With that, I'll pass it along to James English. James, if you're ready, please go ahead.
Good morning, everyone. So we continue to make progress here in Washoe County throughout both the 65 and older underlying health conditions and the essential workforce. Since our last briefing, the health district has administered over 3,300 doses of vaccine. We've completed offering invites through frontline supply chain logistics and frontline commerce and service industries. We'd like to remind everyone in the restaurant and gaming industries to work with their employers to schedule their vaccine. And if they're not getting any satisfactory progress there, please reach out to our call center at 775-328-2427 and we'll schedule you. We have begun working on the frontline areas of institutions and hygiene products, which include all the commercial janitorial service firms and cleaning companies and crews. So those have started to receive invites along with banking and financial institutions over the last day or so. With that, we continue to operate. We'll be doing over 2,800 second doses on Saturday, and we have both first and second doses today and tomorrow. That's it for me, Scott.
All right, thank you, James. We'll pass it along now to Kevin Dick. Kevin, if you're ready, please go ahead.
Yes, thank you, Scott, and thanks everybody for joining us today. Wanted to give everyone an update. We had reported previously on the B117 variant that has been found here in Washoe County, and we have a number of additional cases that are being reported to us by the state lab from their genomic sequencing. And so we'll be putting out a press release later today on those additional cases. They're still coming in from the tests that they're running. So we're tallying those and we'll be reporting a significant increase in the number of B117 variants that are occurring here. So it is definitely circulating and transmitting here in Washoe County. We're not surprised by that, as we have seen what's happened with this variant in Europe, knowing that it's here, that it has higher transmissibility and also higher mortality. We all need to continue to practice our social distancing, wearing masks, washing hands, taking those precautions to prevent the spread of COVID-19. Our 7-day moving average for new cases is currently at 45. So this is increased somewhat over the last few days, and we're watching that number, but we're still continuing to sort of plateau in the 30s to 40s range over the past month of new cases. Our positivity rate, which had been declining significantly and had hit down to 5%, has paused in that decline. We did not go below 5%. We have bounced back up to 5.2% and now 5.1%. So we're watching that number. And I would say in contrast, what we're seeing in Clark County is that as their positivity rate declined, they have gone down to 4.6%, and we've seen that go below 5% in other counties. So I think we need to continue to work to try to prevent the spread of the disease. We are continuing to provide vaccinations. Jim provided the update on where we're at as far as working through essential workforce. We've surpassed 82,000 vaccines that we've administered through our pod at the Livestock Event Center. Nearly 33,000 people we have fully vaccinated through that point of dispensing. And county-wide, we're over 181 100,000 vaccines that have been administered, nearly 75,000 people fully vaccinated. So that's over 15% of the population that we've achieved to date. And so I'm quite happy that we have very many eager people that want to receive the vaccine. And I'm pleased that they are getting scheduled to get vaccinated through the various entities that have the vaccine available. That said, we are still constrained by the supply of vaccine that's available to us. So I ask for people to be patient, as I know that scheduling is difficult, particularly with the opening of the 16 and older with underlying health conditions. So it's a matter of more vaccine being supplied to us, and we are anticipating to see some increase in vaccine next week, and we hope that that will continue into the future. So with that, I'll close my portion of the briefing. Thank you, Scott.
Thank you, Kevin. We'll now send it to Adam Prath with Renown Health.
Hi there, thank you. Can you hear me?
Yep, we can hear you.
Okay, great. So Renown has completed more than 47,000 dose 1 and dose 2 vaccinations to date, which includes Tier 1A medical staff members, Renown employees, students, volunteers, and eligible community members. This week, community members 55 and older with underlying conditions, as well as all community members 65 and older, are receiving their COVID-19 vaccines through Renown. Next week, Renown still has open appointments on Wednesday, March 31st for those aged 45 to 65 with underlying conditions, as well as all community members 65 plus. We're excited to announce that we've made it easier for eligible community members to schedule their appointment for COVID-19 vaccine. After you log into your MyChart account, all you need to do is locate the tile that says, check your eligibility for the COVID vaccine, and then select Schedule Now. If you're eligible to receive the vaccine, you'll be able to select the appointment slot and directly schedule your appointment. If you're not able to view the appointment slots, it's because we're waiting for additional doses of the vaccine, and we ask that you check back for future availability. Thank you very much.
All right. Thank you, Adam, for that update. We'll open it up to questions from the media. We have James English and Kevin Dick from the Regional COVID-19 Response Team, as well as Adam from Renown Health and Dr. Travis Anderson from Northern Nevada Medical Center.
This is Paul Nelson with 2 News. With the drop in the cases and kind of it plateauing, obviously we'd like to see it keep dropping, but is it possible that the reason that we're seeing the lower numbers is because of a combination of the vaccines and because of the amount of natural immunity from people that have already had the virus?
Kevin, you want to take that one?
Yeah, I'll take one. Thanks for the question, Paul. I think it's really fairly early for us to be concluding that the vaccine and people that have already contracted COVID is what's having us at these low numbers right now. I think what we're seeing is the benefit of the precautions that people have taken, the pause that the governor instituted, and those the low capacities that we had in a number of our businesses that were at 25% and then 35%. We've now increased that to 50%, and I would expect that if that we may be seeing some cases resulting from that, that we would start seeing around 40 days out. That said, of course, it is helpful. Every person that's vaccinated is going to help slow the spread a little bit, so that it could be contributing, but it's not controlling at this point. I think that's important for people to understand. We really need to increase our vaccination rate to really have that control the spread of disease.
Adam, did you want to chime in on that one?
No, sorry, inadvertent hand there. I'm not sure how that happened.
No worries. Any other questions from media? And please specify who you want to answer your question.
This is Paul Nelson again. This one will be for Jim. When it comes to on April 5th with it opening up to anyone over the age of 16, Is there an urgency for, or would you like to see everyone that's eligible right now to try to get in before that date, or will you still continue to prioritize even after that date?
We definitely would like to prioritize those individuals and anyone that has an opportunity through the essential workforce to be vaccinated should go ahead and schedule now. We continue to open our appointments up. Going forward, we intend, as we work with the state of Nevada immunization program, to concentrate on the essential workforce, as vaccine demand will still be much higher than the available vaccine. And therefore, it will be best if we continue to stay with select groups so that not everyone's trying to go to the retail pharmacy program or the select few individual medical providers that also have vaccine. So that is our plan going forward, is to continue to work. But yes, everyone that's is eligible to be vaccinated should be doing their best to go ahead and schedule through whatever means are available to them.
So come April 5th, the plan is to still go in order with the lanes as it already is?
The Washington County Health District intends to stay in the essential workforce lane. Our construction industry and landscaping industry is extremely large here, and we know that they need to have capacity to be vaccinated. We're looking at various different times and pod operations for that essential workforce. But yes, we will continue, at least in the beginning, to work through the essential workforce lanes.
Hi, this is Laura Calzada with Reno Al Dia. We've been saying that people 16 up with the pre-existing conditions can go to the pharmacies and get the vaccine. But we have some people calling us and letting us know that there's no vaccines at the pharmacies, and they're calling to set up appointments. So what can we tell them?
I think the best message right now is to go ahead and continue to check the website nvcovidfighter.com for additional retail outlets. And I think I'll let Adam continue to speak to this on what they may have in the way of availability going forward.
Okay, thank you. They say they have, but the only places are in Las Vegas, and it's kind of far.
So, Laura, this is Kevin. If I could speak to that, it really just is a matter of the supply of available vaccine that's being allocated to Washoe County. And my understanding is that the allocation is population based from what the federal allocation is to the state. So, that's why I suggested people be patient, but they continue to look for the opportunities to be scheduled. It's a huge population that's 16 and older with underlying health conditions. And it's just not possible to have everybody be able to get vaccinated, have an appointment available for them with the supply that we have right now.
Okay, thank you very much.
Yeah, and if I can add, at Renown, our plan again next week is to age band to those 45 plus with underlying conditions, and we'll be watching the availability of appointment slots on our clinics, and if those don't fill up, then we will move that age band down. We just want to make sure that we can have appointments available for those folks.
Hi, this is Bob Conrad with This is Reno. I'm not sure if you can hear me. I have a question about the UK variant.
Sure, Bob, we can hear you.
Yeah, so what was the large gathering that was reported about a week ago, and why were more details not released about that?
Well, we've had a couple of gatherings or events that have we know have had B117 variant clusters around them. One was a celebration of life event that occurred, and we've also had a youth volleyball league that has had a number of the B117 variants. And we've been working with people that were identified as close contacts at those events for isolation and quarantine and testing.
When you say youth volleyball, what's the age range of that?
So high school age range.
Was it a school district gathering, or was it a outside of? Yeah.
We have both club sports and high school sports involved. There's crossover between those who participates in those leagues.
Okay, so if it was a sports gathering, were there precautions being taken? Were they wearing masks, or what was happening there?
Yes, that's my understanding, is that they were wearing masks and precautions. And I think it's important to understand, Bob, that while the cases are associated with youth athletics, that doesn't necessarily mean that it's spread on the court. There are, the team builds a lot of camaraderie and are gathering together outside of the actual sporting event. And so we think that is probably a real contributing factor in the spread.
Okay, so the celebration of life was the one that about 60 to 80 people attended, where the initial case of the UK variant was found and then spread to about, I believe you reported about 17 people. Is that correct?
That's correct on the approximate size of the gathering. I don't recall if it was 17, but somewhere around there, I believe, Bob.
Okay, thank you.
Hey, Bob, just for clarification for you as well. I believe that of those 17 cases, not all were Washoe County residents. There were people that had traveled here for that celebration. And so some of those may not show up in our Washoe County numbers, but they were tied to that gathering.
Thank you.
Any further questions? All right, hearing none. Thank you to all of our guests who are here. This meeting is being recorded and it will be put on the COVID-19washoes.com site here shortly. Thanks again for being here.